everybody, my name's Brian, and today I'm going to be sharing with you my sample teaching plan on the dynamic body systems of the cardiovascular and respiratory systems. In this presentation, I'll provide an overview of my subject, discuss the level of instruction that it comes with, any learning objectives we might have, the overall content of everything we'll be going over, any teaching strategies I might incorporate into my teaching plan, some activities I might have my students do along the way, and how I would grade those activities. Okay, so my teaching plan comes from the 5th week of a course called Healthcare Concepts 4. It's actually a course I took in my associate degree nursing program. The class is basically over the major concepts that you'll encounter in healthcare, such as like infection control, body systems, and how they function or rely on one another and maintain homeostasis, that sort of thing. But since this is the 4th course in healthcare concepts, this would be considered at the senior level of teaching. This week's teaching plan will include the learning objectives of having our students to describe the structure and function of the respiratory and cardiac systems. We'll have the student describe the role each of these organs plays in maintaining homeostasis. The student should describe how the lungs function, how respiratory or respiration functions at both the macro and the micro levels, as well as how the heart pumps blood, how it initiates a contraction, and how it moves blood and other bodily fluids around the body. The student will also go over some of the most common diseases and disorders that we see in these organs and how they can affect a patient's health. And lastly, we'll have the students engage in a critical thinking activity to have them apply the knowledge that they've learned in this lesson plan and test them on it. So our lesson plan will include an introduction into the cardiovascular and respiratory systems. We'll go over the anatomies of these organs, the major structures that we see, and the functions of each of those structures. We'll go over to how the organs work, how the heart beats, the cardiac cycle. We'll go over heart sounds and what they mean, as well as breath sounds. We'll go over the function of each of these organs. We'll investigate how gas exchange occurs at the cellular level, as well as circulation throughout the whole body. And lastly, we'll go over the major diseases that we see in these organs and how they might impact a person's health. So the teaching strategies that I'll use in my teaching plan are going to include, of course, the boring old PowerPoint presentations. We'll have, condensed bullet points of each of the main ideas of each topic, and I'll expand on them to the class as we go over them. I'll ask the students throughout the lecture engaging questions to make sure that they're paying attention to the content and that they're using what they've learned. I'll have my students divide up into small groups and we'll have discussions. I might pose a challenging question to them and have them sort of brainstorm over it and see what they come up with. We'll also have a case study involving a patient that suffers from some sort of the common diseases that we'll go over involving the respiratory or cardiac systems. And I'll pose questions to the students on how they might go about treating this patient or taking care of them. I'll also have a small activity involving how the student might collaborate with other professions that they might work with in the healthcare setting, such as a respiratory therapist, for instance, and how they might work together to sort of bring a better outcome to the patient's overall health and well-being. To evaluate my teaching plan, I'll have my students engage in both formative and summative evaluations. So I'll maybe throw a pop quiz out there every now and again to sort of gauge my students' understanding of what I've gone over. I might have the students work together again in like a group discussion maybe, or some sort of group project. For the summative evaluations, I don't like to do it, but we might have to have a unit exam for this class. Healthcare Concepts is a pretty foundational course, so I want to ensure that every student has a solid understanding of the material that we're covering. Some of the criteria that I'll be assessing in these assignments will include the students' knowledge and understanding of these organs and their function. I'll have them apply what they've learned into a clinical scenario to sort of show how they're able to, use what they've learned basically. I might have them do a critical thinking analysis of any diseases or disorders that are seen in these organs. And I'll also go over the organization of their assignments, their work, to see the clarity of it and what content is included in their assignment. My teaching plan will help guide students to gain a firm foundation in their understanding of the anatomy, the physiology, and the interdependency of these two critically important organ systems on one another. Students will develop critical thinking skills through exploration of case studies involving breakdowns in these organs. The presentation, the material, and the assignments are all geared towards encouraging student participation and collaboration among their peers. I'm also giving them plenty of opportunities to apply what they've learned into a real-world scenario. Through the formative and summative evaluations, I'll be able to ensure that my students understand the material and assess where they might be struggling along the way. This teaching plan will provide the students with an engaging, interactive, and comprehensive learning experience about these two very vital organ systems. Thanks.